Because we know that early detection exponentially increases a woman's survival rate, the AKR Foundation focuses on early detection research. We are proud to have funded multiple Amy Krouse Rosenthal Foundation ovarian cancer early detection research grants through the Foundation for Women's Cancer, and we are committed to fund additional research for the next cycle. These grants aim to provide new, early, non-invasive screening, thereby changing and improving ovarian cancer testing and diagnosis. Two of our researchers are here now to briefly tell you how your support can change the future and save lives.
Hi, I'm Dr. Mona Guo, and I'm a gynecologic oncology fellow with a research interest in early detection of ovarian cancer. As a gynecologic oncologist, I've seen the vastly different outcomes for patients diagnosed at early compared to late stage of disease, and wish I could quote all my patients a 90% survival rate. However, a reliable method for early detection remains elusive, and our current tests are unable to reliably differentiate between a benign mass and cancer. Just as the symptoms of ovarian cancer are similar as many benign conditions, so do the same markers for ovarian cancer also go up with many non-cancer reasons. As such, a number of women end up obtaining inadequate or incorrect surgical or medical management, ultimately delaying their cancer care or treatment. As a gynecologist, I've counseled numerous women on the uncertainty surrounding their pelvic mass diagnoses, and wish I had a better way to differentiate who should be evaluated immediately by an oncologist and who can safely wait and see. My research fills this clinical void by developing a sensitive and specific test evaluating epigenetic changes in tumor cells from the peripheral blood. The Amy Krouse Rosenthal Foundation grant will help fund the acquisition of samples to validate this liquid biopsy for the eventual development of a diagnostic blood test for ovarian cancer. We hope our research will provide patients and their providers much needed direction during this difficult and often confusing journey, and help lead to the earlier diagnosis of this life-altering disease.
Ovarian cancer has a high rate of mortality, which is mostly due to advanced disease. Therefore, early detection allows us for a diagnosis at an initial stage in which treatment can be more effective. My goal in this project is to identify changes in circulating platelets related to the presence of ovarian cancer before it becomes manifest. This will allow us to detect ovarian cancer earlier, improve surveillance of recurrence, and finally reduce mortality rates. This grant will allow me to test a completely new idea with results directly applicable to the clinic, and it is a privilege for me to be recognized with such an important award, and findings like this are critical for starting new high-risk projects just like mine. I want to use this opportunity to thank all the people involved in the Amy Krouse Rosenthal Foundation, whose work is indispensable for patients and for us researchers. Thank you.